Hi, so my name is Capucine and I run the International Coalition to Eliminate Hepatitis B, and I also work at the Hepatitis Fund. I've been working in this field for 6 years now, and what I couldn't believe when I moved into hepatitis coming from the HIV field is how difficult it was for people living with hepatitis B to access treatment. Because it happens that they pay up to 10 times more for the same medicine, for instance, tenofovir, than people living with HIV. And I really wanted to understand why and how we could help them access treatment. And so I started this project with the Medicines Patent Pool and other stakeholders at the ICE-HBV Stakeholders Group to understand how can people access hepatitis medicines. And that's why today I'm with my colleague Mila Maistat, and we're going to discuss the best strategy to access hepatitis medicines. Hi, Mila. So Mila, I'd like to know, what are the barriers for access to hepatitis medicines? What are the procurement issues?
Hi, Capucine. Hi, everyone. Yeah, right. As you mentioned, there are actually many barriers in countries for accessing the essential medicines for people in need. And as you mentioned, many low and middle income countries are not able, unfortunately, to provide all people in need with those medicines. So among the barriers are, of course, low awareness, poor surveillance systems, no prevention programs, but also high prices for treatment, especially, for example, for hepatitis B treatment from one side, and limited budgets for implementing national hepatitis programs from the other side.
So what can countries do to improve procurement?
Yeah, I think it's essential that countries start planning procurements in advance, and for that, and in order to choose the best procurement strategy, they have to possess some strategic information. Like, for example, first of all, they need to know if a medicine is patented or not.
So what are the best scenarios for that? What is the impact of a medicine being patented or not? Is that the best option?
Yeah, like, of course, the best scenario is if there is no patent, or patent expired, or patent was revoked, or patent was withdrawn, like, for example, in case of the platosphere. In that case, countries can just buy medicines from generic manufacturers. Of course, it is important to remember about and to ensure the quality of medicines. And the best way to ensure that is to procure WHO pre-qualified medicines, or medicines approved by FDA or other stringent regulatory authorities. And usually NPP licensees produce medicines which are pre-qualified by WHO or FDA approved.
Okay, but what do we do if the medicine is already patented?
Yeah, if the medicine is patented, that's another story. And in that case, I think the next necessary step is to check whether a medicine there is a voluntary license for that medicine or not. Very often, people in charge of procurements in countries, they know that information because they are in touch with their patent country offices. Very often they contact directly Medicines Patent Pool to check that. I would say it's the best and the quickest way to check if a medicine is patented or licensed is to use the MedSpol. MedSpol is the database of Medicines Patent Pool, which shows license and status and patent status of medicines which are recommended by WHO, or medicines which are about to make it to WHO list of essential medicines.
So Mila, if a medicine is patented, what do we do next?
Yeah, if a medicine is patented, it's a different story. So first, we need to check, or country need to check if there is a voluntary license issued for that medicine, or combination or formulation. Very often, people in charge of procurements within Ministry of Health teams, they are in touch with the country patent offices, or they can directly contact NPP, which they often do. But the easiest and the quickest way to check that is to go to MedSpol. MedSpol is a database of Medicines Patent Pool, which shows the patent and license status of medicines, combinations, and formulations. So if there is a voluntary license, then they can procure generic medicines from those licenses.
Okay, and what do we do if there's no license?
Yeah, if there is no license, that's a different and I would say more complicated story. So, and in that case, countries may opt for different access strategies. For example, some countries issue a compulsory or government use license, which enables them to procure medicines from generic manufacturers without consent of patent holders, originators. Many countries opt for direct price negotiations. And assumption is, of course, that the bigger the volume, the lower the price is. However, there are many other factors influencing the price, and that is why some countries prefer to do procurements through Global Fund or through UNDP or other global or international procurement mechanisms.
So we're talking about countries now, but what happens when like big NGOs, big programs provide in-country treatment? How do they do it?
Yeah, in that case, actually, yeah, in many countries, or in some countries, there are really active NGOs which are running treatment programs, testing and treatment, but also prevention, which is great. And very often those in those countries, these active NGOs, they start with small programs targeted at specific populations. Like, for example, in Ukraine, there was a small pilot program for 50 people who use injection drugs. And that programs was gradually expanded to 5,000 people, but also those pilot programs or early access programs, they also trigger national response. In many cases, in some cases, those programs are expanded to general population, and that is how governments may become more active also and implement a national hepatitis program and start treating general population.
Oh, that's wonderful to hear. I hope that's going to be inspirational. And I invite everybody to check our website and the Medicines Patent Pool website for more information, or to be in touch. And yes, to join us in trying to improve access to hepatitis medicines around the world.